they behave almost as if they've been cured of the osteoarthritis. They know they've not been cured. Yeah, osteoarthritis is actually a degenerative condition, a degenerative disease of the joints, where the cartilage, the cartilage is the end of the bones. When the two bones meet, where they meet, it's called the joint. The cartilage is the cushion at the end. When that begins to break down, it causes inflammation, pain, stiffness, sometimes swelling, loss of function, reduced motion. That's osteoarthritis. It's quite common. Well, actually, there is no cure for osteoarthritis, not that we know at the moment. The objectives of treatment remain: relieve the symptoms, improve or maintain hand function, and enhance the quality of life. That remains. So that's why sometimes lifestyle modification can help a lot of people. You maintain some gentle hand exercises, so reduce stress. So they remain supple. Make sure you don't overdo it, because if you overdo it, that becomes too much stress on the joints as well. So we use things to alleviate joint stiffness, things like heat compress, cold compress. If they use certain tools, they help. Like people have base of the thumb osteoarthritis, may use certain tools that help them do something, maybe tie shoelaces or pick up things from their kitchen. This is help. Okay, we obviously reduce the weight. Too much weight is not good on the person. And take the over-the-counter medications or take the over-the-counter supplements. All these things do help. And it goes a long way in helping a lot of patients, from my experience. The natural history of osteoarthritis is that you're going to have periods of exacerbations and remissions. During the periods of exacerbation, the hand is so bad, patients say, cut off my hand. In the periods of remission, don't even remember it. That's it. So it just continues. It's a progressive condition. It continues to get worse. Over time, the fingers become stiffer, or over time, they become a bit more deformed and things like that. And patients actually learn how to manage them as far as the pain is not too much. My experience is that most of the time, in the end, what limits patients most is the pain. If the pain is not that bad, patients just manage themselves and continue. Well, there's no cure. There's no cure at the moment. That's the way it is. But I mean, there are lots of research being done. But all these lifestyle modifications and surgery, when necessary, on a particular joint, can help patients. But I will say something. Even though the condition is not cured, my experience is that most of the time, there's one or two joints that bother the patient so much. And if you do something to relieve the pain in that particular joint or in those joints, those one or two joints, they behave almost as if they've been cured of the osteoarthritis. They know they've not been cured. You also know that they haven't been cured. There's so much new lease of life. They can do what they want. Improves, enhances the quality of life. So that's where we are with osteoarthritis at the moment.